Hello and welcome to PCCN Review Certification Coach. My name is David Woodruff. I'm the editor of Critical Care Nursing Made Incredibly Easy. I hope to make this incredibly easy for you too. Let's talk about how to go about becoming PCCN certified. The first thing we need to talk about is whether or not you're qualified to take the exam. So there are a couple different options for qualifying for the PCCN exam. First of all is you need to have an RN licensure and it has to be in good standing. So if there is any kind of a problem with your licensure, let's get that evened out first before you pursue PCCN. Now there's a 2-year option. That would be if you have 1,750 hours of direct patient care. Now that sounds like a lot of time, doesn't it? 1,750 hours. But a full-time job is actually 2,080 hours per year. So this is over a 2-year period. You need to have 1,750 hours. That would be working like about half-time. 875 of those hours need to be in the past year. So you need to be currently working at least half-time or about half-time in a progressive care type of environment. We have to be taking care of acute and progressive care patients. So this really is a pretty wide range of different patients. Acute care patients or progressive care patients. So anybody who's taking care of patients in an area where they're high acuity, and that could be a med-surg floor, that could be telemetry, that could be progressive care, it could be the critical care unit, it could be the emergency department, it could be PACU. So there's a variety of different settings that this certification qualifies you for. One of the real advantages of that is that having this certification lends itself to being able to move to different areas as well. So maybe right now you're working on a telemetry floor. At some point in time you hope to move into critical care, or you hope to move into the emergency department or somewhere else. The PCCN certification has a wide range of acceptance because it is acute and progressive care patients. It's not limiting itself to just critical care or just emergency or whatever the case may be. Now there's also a 5-year option. With a 5-year option, you need to have worked 2,000 hours in direct patient care over the past 5 years. So if you're a nurse who's just out of school for maybe 2 or 3 years, you're looking at the 2-year option, and those would be the qualifications you need. If you've been working for at least 5 years in progressive care, then you could take a look at this 5-year option. You don't have to have as many hours of direct patient care. So for example, maybe you started out and you were working full-time or half-time, and in the past year you had some other things that you were doing, maybe going back to school or something like that, and you only worked 144 hours in the past year. That's not a whole lot. Again, you're caring for acute and progressive care patients, and you need to have a total in that 5 years of at least 2,000 hours of direct patient care. So those are our two options for qualification. You can have these benefits: fewer adverse effects in your patients, fewer errors, more confidence, higher job satisfaction, better patient satisfaction ratings, and more effective communication and collaboration. All of these benefits you get from becoming certified. Wow. So how does that happen? Is it just because you got a few extra initials after your name that you get all of these additional benefits too? No. You knew that was coming, right? So it's the process of becoming certified. That is what lends all the benefits. So going back now and reviewing things that you learned previously, maybe at a deeper level, and maybe there's going to be connections that you didn't make previously, or there's going to be additional components that you're going to learn that you'll be able to take back to your clinical practice, and it will improve your practice. So therefore, that's why you see fewer adverse effects, fewer errors, and more confidence. All those things lead to a higher job satisfaction and better patient satisfaction ratings. So what do you do in order to be able to get all those benefits? Well, first of all, we're going to have to make an action plan. And that's what we're going to be doing in this program as we're going along. We're going to be making an action plan for you to help you to be able to identify those areas of weakness. Now, how do you identify an area of weakness? I'll tell you kind of a quick way to identify your areas of weakness. It's the stuff you don't like. How many people say, hey, I love endocrine. I love neuro, and there are people like me who love neuro, but for the most part, those are going to be areas that many nurses struggle with, and so those are going to be areas we try to avoid. We don't like endocrine. How many people want to go to an endocrine conference, right? Because it's very complicated, and a lot of us don't understand it, so that's an area of weakness. So if you're looking through your handout and you're thinking, oh boy, I don't like that, that's an area probably of weakness that you need to work on. And you're going to identify these a little bit more as we go through the program. Hopefully you'll be able to really hone in on some of those. Choose your study aids. Now, you don't need anything more than what you have with this program. The handout, the videos, and all of the extra pieces that are included with the program, that's all you need in order to be able to be successful on the PCCN exam. However, if you would like to get additional materials, I would recommend the materials from the American Association of Critical Care Nurses. Remember, they wrote the exam, so they've got the idea of what it is that they think is important and that you need to study. So I would suggest using their materials as opposed to getting other outside materials for the PCCN. Plan your study time. The time isn't just going to appear. If there's a void in the universe will fill it. And I'm sure you see that with your schedule, that if there is a void in your schedule, somebody's going to put something in there and fill that up. So we want to plan our study time. Now, when you're planning study time, that doesn't mean that you're going to block off all day Sunday to sit down and cram. What we want to do with our study time is take it in chunks, little pieces at a time, 15, 20 minutes at a time. You can have longer study periods. Maybe, for example, you want to form a study group like the picture here. That's great. Okay, plan those times too, but plan at least 5 days a week that you're going to have little chunks of time that you're going to be reviewing and you're going to be studying. It's those little chunks of time that are going to help you to be able to really understand the content. And you're also going to take this back to work. So if you study for maybe 10 minutes in the morning while you're eating breakfast or grabbing a cup of coffee before you go to work, and then you go to work, whatever you were studying is still rolling around in your mind, and your brain's trying to figure out how to classify this information. When you're at work and you're doing things, your brain is going to have those file folders open, those file cabinets open, and be looking for places to find information. And it may just happen to say, oh, this is where that piece of information goes. How often have you seen that happen? Maybe you studied something, you heard something, you read something, you go to work and it clicks for you. Because you're in the environment, you're doing it, your brain is in that gear, as opposed to maybe being in the gear of being home and having other responsibilities, etc. So plan some study time in there, little chunks at a time, and maybe some bigger chunks that you can really sit down and immerse yourself. But don't just immerse. That's a hard way to study, and you're not going to remember a lot of what you do. Commit to a study date, or test date, rather. So commit to your test date. Think of a date right now. And I would suggest at least think about 90 days. Okay, and I shouldn't say at least because you really don't want to go out too far. I've heard people tell me that, hey, this year they're going to do the PCCN review, and the next year they're going to take the exam. Okay, by next year, you'll forget what you did in your review. So let's plan like a 90-day study time. That's a good period of time. I've also had people who've come to my programs and said, I've got the test scheduled for Friday, and I'm taking the class here on Monday and Tuesday. Okay, so that's kind of a rush job. In some cases, it works, but I wouldn't suggest that. I would suggest that you plan your study date or your test date out a little bit, plan some study time in the meantime so that you can make sure that you're prepared by your test date. And, all along here, we've been talking about study, haven't we? You knew that was coming, didn't you? Yeah, there's really no good, easy way to get this other than you're just going to have to study. Because there's going to be concepts that you don't understand. There's going to be concepts that maybe are new that you're not using every day. But the American Association of Critical Care Nurses wants you to know these things so that you can be a well-rounded progressive care nurse. So what kind of things can you expect from the exam itself? Well, the test format is 125 questions. They are multiple choice questions. The test map is included in your handout, so that's what we're going with in this whole program is the test map. That's exactly the test map from the AACN that we use to make the outline for this program. The test questions, again, are multiple choice. There are no building questions. In other words, it doesn't have 3 questions in a row that build on each other. They're all standalone questions, and they're all multiple choice. The certification is for 3 years. You can recertify either by retesting. Some people like to do that, just to make sure that they're still remembering the concepts, or you can recertify by getting CERPs. CERPs are the AACN's version of CEUs. You can use CEUs to get CERPs, but you can also use a whole bunch of other things. You can be involved in professional activities in your workplace. You could be working on some scholarship, such as writing an article or doing presentations. You can be involved in the AACN and be on a committee or be on a work group for them. And all of those things count for CERPs. So once you get certified, then I would suggest that you get their recertification handbook and start looking at that so you can start planning ahead to how you're going to get these CERPs. If you're in school, maybe you're going back and you're getting another nursing degree. It has to have something to do with nursing. And you can use that academic credit as CERPs. So there's a lot of different ways you can get CERPs, and I would suggest that you read that over. Don't get real involved with it right now. It's not hard to get the CERPs that you need for recertification. The exam questions themselves, about 80% of the exam questions will be on clinical judgment. They'll be age appropriate for adults, so we're not going to see content in here about pediatrics or neonatal. Okay, there are different exams for those. Right, so it's going to be clinical judgment type of questions for 80%, and then 20% of them are professional caring and ethical practice. Now, where this gets a little bit confusing sometimes is the professional caring and ethical practice questions don't just jump right out at you. So it's not going to say, in a professional caring and ethical practice environment, they're going to be just questions, maybe talking about a physiologic issue, but how you would deal with that in a caring and ethical way. So they don't just jump right out at you and hit you over the head and say, hey, this is a professional caring and ethical practice question. So we have to be a little careful when you're reading some of the questions. And we're going to have lots of examples as you go through this program. So you'll have plenty of opportunities to be able to look at questions and to be able to practice questions. Keep in mind, too, that before you go take your actual PCCN exam, you need to take the comprehensive assessment that is part of this program and score an 80% or better to make sure that you are ready to go. So where can you get more information about the exam itself? Well, go to the AACN, so it's aacn.org, and this is the entire URL up here at the top if you wanted to go directly to the PCCN exam. So that's the aacn.org certification / get certified / PCCN-adult. And this is the page that contains all the information you need about the PCCN exam. So what do you need to get started? What are the qualifications, etc.? And from this page here, you can actually register for the exam right here on this page. Now, there's 2 steps in the registration process. The first thing you have to do is you have to register through AACN for the PCCN exam. This gives you the opportunity, so they're going to ask you questions about your clinical practice, etc. They have to make sure that you're actually qualified to take the exam first, and you have to pay a fee and all that other kind of stuff. Then, after you've done that, then they're going to send you to the organization that actually administers the exam. So AACN doesn't give the exam. So they're not going to say, hey, come on over here and take the AACN exam. You have to schedule that separately with a different organization, okay? And that is the PSI Testing Center. So, and here's the address at the top. So there, the full address. Now, you can't do this until you get a letter back from AACN saying you're qualified to take the exam, and then they will give you a number. When that happens, then you can come to this website, and they'll give you the address, so you don't have to write it down or anything. But they'll give you, and you go to this website here, and you over on test takers over on the left, you can go and click on begin scheduling, and you can schedule your exam. Some test-taking tips. You're going to see these all the way through this program. Then we're going to be talking about study skills, exam strategies to help you confidently pass the exam. You're going to be looking for these little pink boxes as we go through the program here. There are going to be several test-taking tips are going to be offered. And just look for those boxes for the tips as we move through the program. All right, then, tip number 1. Avoid multitasking. Multitasking requires your brain to switch from one task to another. So as you're doing your studying, I would highly encourage you to find a quiet place or whatever works for you. Some people would rather be at Starbucks. That's called that third place where there's background noise, but the background noise is not anything you have to pay attention to. You may have background noise at home, but it might be stuff you have to pay attention to, like kids screaming or whatever. Okay, but whatever works for you, find that place where you can concentrate, because you're really going to need to fully concentrate on this material to fully integrate it. So I think we highly value multitasking, especially in nursing. But multitasking requires your brain to switch from one activity to another. It's very difficult to be able to hold 2 activities in your brain at the same time and give them equal attention. In fact, brain science tells us we can't do that. In fact, what we do is we actually switch like a light switch. You switch from one to the other and then back to the other one. Unfortunately, in order to get back to the level of concentration you previously had, it can take up to a minute. So that's quite a long period of time. If you've got kids that are, pulling your attention away from this, and you're bringing your attention to them and then back to this and them and back to this, each time you do that, there's going to be a short delay in being able to get that concentration back again. And so it's going to be harder to be able to really integrate these concepts. What we're thinking now happens instead of multitasking is you actually have this process called switch tasking. And that's what we want to try to avoid, because that ends up leading you into having some superficial studying and superficial learning instead of having this deep learning that you're going to need in order to be successful on the exam. Well, thanks for joining me for the introduction. Let's move on here and get right into the content so that you can start studying for the exam.